Most births work best when they're left alone. The design of birth is to take place with privacy in a quiet space with trusted support and minimal interruptions and interventions. Under these circumstances, labor hormones are able to flow freely, muscles are able to relax and yield, and the connection between mom and baby is open. Interventions in labor aren't necessarily bad, especially when they are truly medically necessary. However, it's critical to understand that interventions are typically not singular events. In this video, we're learning all about the cascade of interventions and how it can impact labor, birth, and postpartum. I'm Bridget Teyler. I'm a childbirth educator, birth doula, and a mama, and it's my passion to help parents have the happiest, healthiest, easiest pregnancy, birth, and postpartum experience. Make sure you subscribe to this channel and hit the bell so you don't miss out on any future videos. When it comes to labor interventions, it's rarely one and done. One intervention requires another intervention, and this can lead to something called the cascade of interventions, which is when unwanted or unintended interventions or outcomes happen because of an earlier intervention. To expand on this idea, let's look at a common labor intervention, the epidural. In order for a woman to receive an epidural for pain management in labor, she is going to need an IV catheter placed and a saline solution given through the IV due to a drop in blood pressure that usually follows the epidural. A catheter is also placed after the epidural is working through the urethra into the bladder because mom can no longer pee on her own. The epidural numbs from the waist down, and this lack of sensation actually lowers the amount of natural oxytocin that the body releases, and oxytocin is what keeps labor progressing. That, along with the fact that mom has to now stay in bed and has more limited movement, can cause labor to slow or stall. This can result in the use of Pitocin, which is synthetic oxytocin, to get labor contractions going again. Mom also has to be continuously monitored to keep an eye on how baby is tolerating the interventions and to monitor the frequency and intensity of the contractions. Now, Pitocin sometimes causes an unintended effect of distressing baby because the contractions become unnaturally frequent and intense. The monitor picks this up, and this can sometimes be a false alarm or it's true distress. In response, sometimes medication is given to force the uterus to slow down, or an emergency C-section becomes necessary to rescue baby from the effects of the interventions. Or maybe mom does get to the end of labor and she starts pushing. Sometimes because of the lack of sensation from the epidural, pushing is longer and more challenging, resulting in the use of instruments to assist birth. Statistically, epidurals are correlated with increased use of forceps or vacuum to bring baby out of the birth canal. Now, this isn't to say that because mom gets an epidural, all of these things will surely happen. This is just to paint the picture about how one intervention is not actually just one intervention, and how the decisions made in labor influence the experience and the outcome, whether it is intentional or not. Now, sometimes mom will go into labor with the intention of not using any interventions and end up needing them. This is when being informed about what options are available to you and how to keep labor as normal and natural as possible in the event of an intervention is critical. In the Built to Birth course, I teach you all about how to labor smarter, not harder, and how to support labor as naturally and normally as possible. If you don't know how to do that yet, I want to help you get informed and empowered for your birth. So go to builttobirth.com, which is linked in the corner of this video and down below as well, and check out the resources that I have for you there. Unknowingly falling into the cascade of interventions can feel scary and like you're losing control. So the best thing that you can do to avoid this is to know what interventions are, how you can best support your labor without them, and what to do in the event you need them. You learn that in the Built to Birth course. I hope this video has helped you understand what the cascade of interventions is and how one intervention is not usually one and done, but also requires the use of other interventions as well. Thanks for being with me in this video, and I will see you in the next one. Bye.